Picture this, 3,000 people, the sun on their faces, sailing away from Florida into the sparkling Caribbean. It's the dream vacation they've saved for all year. Fine dining, laughter echoing across the decks, crystal clear swimming pools, and mountains of food at the endless buffets. It was supposed to be 7 days of pure paradise. But in less than 24 hours, this luxury lineup, the oasis of the seas, would transform into a floating nightmare. Passengers would be collapsing in the hallways. The sounds of vomiting would replace the sounds of celebration, and people would be begging to go home. What could possibly cause such a rapid, devastating collapse? The culprit was a tiny, invisible enemy, hiding in plain sight. This all happened in January 2019. As the oasis of the seas left Port Canaveral, everything seemed perfect. But somewhere among the thousands of excited passengers, one person was carrying a silent stowaway. Norovirus. You might have heard of it as the stomach flu. But this is no ordinary bug. It's one of the most contagious viruses on the planet, and it was about to unleash chaos. How does it spread? Faster than a rumor in a small town. A simple handshake, a shared serving spoon at the buffet, touching a contaminated door handle. That's all it takes. And on a crowded cruise ship, it's the perfect storm. The first few complaints trickled into the medical bay just hours after departure. A passenger feeling a little nauseous here, another feeling queasy there. Ship doctors likely thought it was just a bit of seasickness. But they were wrong, dead wrong. By the second morning, the trickle had become a flood. Over 300 people were violently ill. The ship's small medical center was completely overwhelmed, with lines of sick passengers snaking down the corridor. People were vomiting uncontrollably, suffering from severe cramps and diarrhea. Then, the crew members started dropping, one by one. The very people meant to care for the passengers were now victims themselves. In the end, the official count was staggering. More than 700 people were infected. The ship had become a floating hospital ward. The captain, facing an unprecedented medical crisis, had no other choice. He made an announcement that shattered the vacation dreams of everyone on board. The cruise was over. They were turning the ship around and heading back to Florida immediately. The paradise they had paid for had turned into pure panic at sea. The party was officially over. So, what makes Norovirus so terrifyingly effective, especially on a cruise ship? Well, this isn't your average stomach bug that you can just sleep off. Norovirus is a survivor. It can live on surfaces like handrails, elevator buttons, and tabletops for days, sometimes even weeks. And it's resistant to many common cleaning agents. And here's the most frightening part. The infectious dose is microscopic. It takes just 18 individual virus particles completely invisible to the naked eye to make a healthy adult violently ill. Now, imagine you're on a ship with thousands of people, all sharing the same air, touching the same surfaces, and eating from the same kitchens. It spreads like wildfire. You might think, I use hand sanitizer religiously. I'd be fine. Think again. Norovirus literally laughs at most alcohol-based hand sanitizers. The virus has a protective shell that alcohol can't easily break down. The only truly effective defense is old-fashioned, thorough hand washing with soap and water for at least 20 seconds. It's the friction and the soap that physically remove the virus from your skin. But on vacation, how many people are that diligent? As the virus raged, life on the oasis of the seas came to a grinding halt. The ship's crew, in a desperate attempt to contain the outbreak, enacted strict quarantine protocols. Sick passengers were confined to their cabins. The vibrant, bustling hallways became eerily quiet, punctuated only by the roaring of food carts. Crew members, wearing masks and gloves, had to deliver bland meals to the quarantine, leaving trays outside cabin doors like a scene from a disaster movie. All entertainment was cancelled. The theaters went dark, the casinos fell silent, and the music stopped. Parents, many sick themselves, tried to comfort their miserable, crying children. The smell of bleach and disinfectant hung heavy in the air, a constant chemical reminder of the invisible enemy that had taken over their vacation. The dream of a Caribbean getaway had dissolved into a claustrophobic, sanitized prison. When the ship finally limped back into Port Canaveral, days ahead of schedule, it was met with a scene straight out of a Hollywood blockbuster. Health officials from the CDC were waiting on the dock, some in full hazmat suits. Ambulances were on standby, and news crews from around the country were there to broadcast the ordeal to the world. The dream vacation had officially become a national news story, a cautionary tale of paradise lost. Here's the hard truth. This entire disaster, affecting over 700 people and ruining the trip for thousands, could have been prevented. It all comes down to basic hygiene. It could have started with just one person. One sick food handler who didn't wash their hands properly after using the restroom. One contaminated serving spoon in the salad bar. One passenger who didn't wash their hands before grabbing a bread roll. That's all it takes. Cruise lines spend millions on sanitation and have incredibly strict health protocols because they know how vulnerable they are. They are constantly cleaning and disinfecting. But norovirus doesn't play by the rules. All it needs is one small slip-up, one moment of human error, and it can ignite an outbreak. This incident is a powerful reminder that even in the most luxurious, controlled environments, we are only as safe as the hygiene of the person standing next to us. And this isn't just about cruise ships. Your next all-inclusive resort, a busy restaurant, or even your office potluck could be the next breeding ground. One careless moment can have a ripple effect that sickens hundreds. So, what's the lesson? Always wash your hands with soap and water before you eat. Be wary of communal food sources like buffets, especially if you see anyone who looks unwell. A little bit of vigilance can make all the difference. The dangers aren't just on vacation. Your own kitchen, the food you buy, and the places you visit every day can all hide unseen threats. Understanding how these outbreaks happen isn't about creating fear. It's about empowerment. It's about knowing how to protect yourself and your family. If you want to hear more real-life survival stories and uncover the health secrets that could one day save your life, make sure to subscribe to our channel. We dive deep into the true stories behind outbreaks and medical mysteries. Thanks for watching, and stay safe out there.